In June 2016, marijuana was legalized in Ohio for medical use, but the laws can be confusing. And here today to help us better understand cannabis as medicine and the Ohio Medical Marijuana Control Program are Lauren Hauschel, an AmeriCorps public ally working as a program assistant with Prevention First, and Charla Henderson, coordinator of the Butler County Prevention Coalition. Thank you both for being here.
Thanks for having us.
All right, first off, give us an overview of this program.
Yeah, so within the program, there are a couple things that you need to be able to qualify for a medical marijuana card. The first is to be diagnosed with one of the 21 qualifying conditions. The second is to be 21 years of age or older or have a guardian in charge of your health care. And number three is to receive a recommendation from a qualifying physician.
So there are a lot of misconceptions about medical marijuana. So talk to us about those.
Yeah, so there are a couple misconceptions that we like to talk about. The first one is that just because it is a recommendation from a physician that it is safe, but just like other prescription medications and other legal medications, they can all have adverse effects. So it's important to keep that in mind and ask your physician as many questions as possible about your medical marijuana card. Another misconception that we like to talk about is how medical marijuana is legally allowed to be used in Ohio. Even with a medical marijuana card, under no circumstance is it allowed to be combusted or smoked.
Okay. All right. So you also mentioned about talking to your doctor as well. And there are questions we need to ask and information we need to know. Charla, tell us.
Yes, so we like to kind of understand this in 5 major target areas when we share this information, and one is going to be workplace. So under the program, by no means is an organization required to accept your medical marijuana use. So employers are still allowed to hire or rehire or drug test based off marijuana use in their organization. Secondly is going to be housing. So the public housing program or housing choice voucher program are not required to accept medical marijuana use and often will deny medical marijuana card holders in their application process. Then third, most people think that insurance is going to cover their medical marijuana, and by no means under the program is insurance able to cover a recommending physician visit or the purchase of actual medical marijuana in a dispensary. Fourth is education. So under several federal policies, school staff, students, and faculty are not under any means allowed to use, possess, or store medical marijuana on a college campus or a school campus premises. And that is really a good information we want to share with students and college age people because it could put them at risk for losing federal loans, on-campus housing, or grant opportunities. And then last but not least, gifting of medical marijuana. By no means under the program are you allowed to gift of any size or any quantity someone medical marijuana. You can't share or exchange because it's supposed to be specifically for the person with the recommendation.
Wow, I did not know all of that about marijuana, but it's really important to know. So there's an opportunity, Lauren, coming up that we need to know about.
Yes, absolutely. We're really excited about this. Prevention First is hosting a panel on March 12th. At 6:30. It'll be a Facebook Live panel. We will have a recommending physician, a healthcare attorney that specializes in cannabis law. So we're very excited about that. And as always, if you are looking for any more information, you can visit Prevention First website at prevention-first.org.
All right, sounds good. Ladies, thank you so much for coming on.